Okay, implants and maxillofacial prosthesis. The implant application for maxillofacial prosthesis. Uh, Originally, the retention of the maxillofacial prosthesis used to be provided via the adhesive bands and adhesive in liquids or spray form and tissue undercuts. And the osseointegrated implants have been employed for retention in the intraoral and extraoral craniofacial regions. There are different retentive systems available with implants, such as the bar and clip system, magnets, and ball and socket retention systems. The use of implants with maxillofacial prosthesis have improved the retention and stability and eliminates the allergic reaction for the skin caused by the adhesives, ease and enhanced accuracy of prosthesis placement, especially with patients with the neuromuscular diseases, and also improve the skin hygiene and patient comfort and increase the lifespan of the prosthesis. The most significant problem in the placement of facial implants is insufficient bone volume. And Jensen and his colleagues classified the bone regions in the face which the facial implants could be placed to alpha, beta, and delta sites. The alpha sites, as you see in the picture with the pink color, these locations have a good amount of bone, typically of 6 millimeters or more, making these sites suitable for retaining a complex facial or dental prosthesis. And examples include the anterior maxilla, the zygomatic arch, and the zygoma. The beta sites found around the periorbital area, as well as the temporal, zygomatic, and anterior nasal fossa region with the blue color. These sites have a bone volume of about 4 to 5 millimeters, and 4 millimeter craniofacial implants can be used in these sites. The delta sites, which includes in the yellow color, includes the buttress, the piriform, and the zygomatic arch, medial orbital, medial orbit, the temporal and frontal bones, and also the zygomatico-frontal process. These areas have a low or inadequate bone of about 3 millimeter or less, and the facial implants can be used in accordingly with these sizes or lengths. Implant retained auricular prosthesis. The location of the implants in the temporal region is very important for the aesthetics of the auricular prosthesis. Usually the implants are placed at the anti-helix level because the retention system must remain within the limits of the auricular prosthesis in order to camouflage it. Usually 2 implants or 3 can be placed in the temporal region or the mastoid bone, can provide the retention of the auricular prosthesis. In this case, 2 implants must be placed within 15 millimeters away from each other and 18 millimeters away from the center of the auricular canal. For the auricular prosthesis, the retention systems can be used are the bar and clip system and the magnets. Implant retained nasal prosthesis. Implant placement in the nasal region may be technically challenging due to the insufficient bone quality and thickness. The implants are usually placed in a triangular plane. The nasal floor and the frontal face of the maxilla are the ideal and the recommended areas for the implant placement. Occasionally, the implants are placed on the glabella, but studies have indicated that the success rate of such implants in this region is low. The retentive mechanisms used are magnets mainly, and bar and clips can also be used. Implant retained orbital prosthesis. Because of the osseous anatomy of the orbital bone, Orbital implants must be placed radially into the orbital boundaries in order to provide sufficient bone thickness for retention. Implant placement in the lateral wall is usually recommended due to the increase in the bone thickness and quality. And placement of implants in the medial border is usually problematic because of the increased anatomical complexities caused by the lacrimal fossa and the lack of adequate bone in this area. In order to provide prosthesis stability, 3 or 4 implants are usually placed in the lateral wall of the orbit. The most commonly used retentive mechanism with implants for orbital prosthesis are magnets. Okay, this comprehensive review about the frequently used extraoral maxillofacial prosthetic material and their longevity, it was concluded that silicones are the most frequently used extraoral maxillofacial prosthetic materials when compared to the acrylic-based materials, and that heat-cured silicones showed superior color stability compared to those cured at room temperature, and also that the intrinsic pigmentation using the molds of the correct colors and proper processing technique promote the longevity of the prosthesis and more color stability. And the white-colored pigments and nano-oxides enhance the color stability even after weathering without compromising the physical and mechanical properties. And that also proper maintenance can increase the longevity of the prosthesis by protecting the prosthesis from the harsh environment and using a mild disinfectant. This systematic review and meta-analysis on the color stability of the maxillofacial silicones, the key findings were that despite of the fact that there has been plenty of research over the past decades on this topic, a single ideal maxillofacial prosthetic material is yet to be identified. It was found that silicones and pigments can degrade, leading to color changes, and that the exposure to the UV light, pollutants, and everyday wear can accelerate this discoloration. The only variable that showed an indication of improved color stability using meta-analysis was the incorporation of the titanium oxides, increased the color stability. And ongoing research is needed to enhance the longevity and the color stability of the maxillofacial prosthetics. Another systematic review about the effect of the nanoparticles on the color stability and the mechanical and biological properties of maxillofacial silicone elastomers. بالنسبة للcolor stability, the addition of nanoparticles such as nanosilica and nanoalumina and hybrid nanoparticles found to improve the color stability of the silicone elastomers. This is particularly important for the maintaining of the aesthetic quality of the maxillofacial prosthesis over time. بالنسبة للmechanical properties, the incorporation of the nanoparticles enhanced several mechanical properties of the silicone elastomers. Improvements were observed in tensile strength, tear strength, and hardness. Biological properties مع nanoparticles contributed to better biological properties such as the antifungal activity. هلا ايش هم optimal concentration for these nanoparticles? It was found that the combination of 1% of nanosilica and 1% of nanoalumina was effective in increasing or improving the mechanical and biological properties of the elastomers. Oral health-related quality of life after the maxillofacial prosthetic rehabilitation. The overall acceptance of maxillofacial prosthesis was good, showing a high satisfaction with anatomic form and color and wearing comfort. And there was significant difference was shown for implant-retained facial prosthesis, which provided enhanced retention and increased ease of placement and removal when compared to the adhesively retained prosthesis. In another review, an individual with oral cancer who had undergone maxillofacial prosthetic treatment, the swallowing function improved significantly. However, the masticatory and the articulatory function did not improve significantly. Now, the oral health-related quality of life of participants was improved significantly after the maxillofacial prosthetic treatment. And thank you.
Thank you very much, Dr. Osama, for your presentation. And inshallah, after the break, we will have our comments. Thank you very much.